Welcome to Supplements Demystified. In today's video we will be talking about melatonin. We will be going over its physical and mental benefits, as well as how much and when to supplement. Commonly sold as a supplement, melatonin is a powerful hormone that affects sleep, health and longevity. It is produced in many body tissues, including the pineal gland, retina and the gastrointestinal tract. Melatonin is involved in managing immune function, mood, blood sugar and much more. Melatonin is able to correct the circadian rhythm of the sleep-wake cycle. Supplementing has been proven to reduce the time needed to fall asleep, increase REM sleep and overall improve sleep quality. A study published in the Journal of Clinical Endocrinology and Metabolism evaluated the effects of melatonin supplementation on patients with documented sleep disturbances. The patients were given 3 mg melatonin nightly between 10 and 11 p.m. for 4 weeks. The researchers found REM sleep increased by 3%, sleep continuity improved, and body temperature while sleeping dropped. A meta-analysis looked at 19 studies involving over 1,600 subjects which tested the effects of melatonin for the treatment of primary sleep disorders. The data showed melatonin reduced sleep latency on average by 7 minutes and increased total sleep time by over 8 minutes. Overall sleep quality was significantly improved in subjects taking melatonin, and the researchers noted that trials which had a longer duration and gave patients higher doses produced even better results. Melatonin has been shown to have a beneficial role in controlling blood glucose in both animal and human studies. A review and meta-analysis published in the Journal of Clinical Nutrition investigated the effects of melatonin supplementation on diabetes. The meta-analysis included 15 high-quality randomized controlled trials and compiled data on diabetes-related parameters, before and after the administration of melatonin. All studies showed significant results in the reduction of fasting blood glucose, insulin resistance, and HbA1c. Researchers note that higher doses and longer duration studies showed better results. However, researchers also found that combining melatonin with food could have the opposite effects, making insulin sensitivity worse. The general consensus is that it has to be taken at nighttime in a fasted state in order to be beneficial for diabetes. Melatonin has positive effects on the treatment of Gerd by the way of lowering gastric acid secretion, increasing lower esophageal sphincter pressure and acting as a free radical scavenger in the gut. A study published in the Journal of Pineal Research compared the effects of melatonin, vitamins and amino acids with omeprazole in the treatment of Gerd. 176 patients were given melatonin combined with vitamins, while 175 received 20 mg omeprazole daily. After 40 days of treatment, all of the patients in the group receiving melatonin reported complete regression of symptoms, while the omeprazole group saw only about 65% report improvement. A study published in the Open Journal of Gastroenterology investigated the effect of melatonin in functional heartburn. Patients that were already being treated with omeprazole were given either melatonin, nortriptyline or placebo over the course of 3 months. The researchers found that melatonin provided the most improvement in symptoms with fewer side effects. Melatonin's ability to correct the sleep-wake cycle can have a positive effect on symptoms of major and atypical depression, as well as seasonal affective disorder. Patients with depression often have disruptions in circadian rhythm, melatonin secretion, core temperature and cortisol. A study published in the Journal of Psychiatry investigated the effects of melatonin on 10 patients with clinically diagnosed seasonal depression. The researchers gave 5 patients melatonin daily and the other 5 a placebo. The study found that after 3 weeks of treatment the participants had significantly lower depression scores. A 2017 systematic review published in a Scandinavian psychiatry journal reviewed the effects of melatonin supplementation on major depression, bipolar disorder or seasonal affective disorder. Some of the studies included in the data showed improvement in depressive scores and correction of circadian rhythms while others did not. Overall, melatonin has potential therapeutic effects for mood disorders, but it is not effective in every person. Melatonin has a broad spectrum effect on building and protecting muscle. Through multiple pathways it is able to aid in muscle development, metabolism and regeneration. Melatonin supports muscle fiber size, mitochondrial health, increases the number of satellite cells, while at the same time acting as an antioxidant, reducing inflammation and reducing muscle cell death. An animal study published in the Journal of Pineal Research investigated the effects of melatonin on recovery from strenuous exercise. Male rats were given melatonin and put through a rigorous exercise protocol to the point of exhaustion. The researchers found that melatonin reduced both muscle and plasma levels of pro-inflammatory cytokines, and increased the release of growth factors. The study concluded that melatonin lowered systemic and muscular inflammation, decreased oxidative stress and increased recovery. A study in the Journals of Gerontology investigated the relationship between melatonin secretion and muscle strength in the elderly. The study included 760 individuals and measured their melatonin secretion via blood and urine tests. The researchers tested the participants' grip and leg strength, and made sure to correct for any confounding factors. The study concluded melatonin secretion was significantly associated with muscle strength. Melatonin has a well-documented ability to quell oxidative damage in cells and tissues, including human cells. It is widely considered one of the most potent free radical scavengers known to man. A study published in the International Journal of Cardiology examined the protective effects of melatonin in patients undergoing coronary bypass surgery. Patients were split into treatment groups of 15 and received either 10 or 20 milligrams of melatonin for 5 days before the surgery. The patients who received melatonin had better ejection fraction, lower heart rate, and much lower levels of pro-inflammatory cytokines and oxidative stress. An animal study investigated the effect of melatonin on pancreas transplants in pigs. 48 pigs were divided into 3 groups. The first group received melatonin, the second was given vitamin C, and the third received 0 antioxidants. Melatonin and vitamin C were given intravenously during the surgery and for a week post-operation. The group that received melatonin had reduced indicators of oxidative stress, and the life of the transplanted organ was more than tripled. Melatonin has potent anti-inflammatory activity by modulating both pro- and anti-inflammatory cytokines in response to acute and chronic inflammation. An animal study published in the Journal of Pineal Research investigated the effects of melatonin on cadmium poisoning. One group of male mice were given melatonin and another group a placebo for 3 days before researchers administered cadmium. The study found that the mice treated with melatonin experienced less toxicity, less inflammation, and less cell death in the liver compared to placebo. Another animal study investigated the effects of melatonin on early brain injury. The researchers found that mice who experienced a subarachnoid hemorrhage and were then treated with melatonin had a much higher survival rate. The administration of melatonin increased the survival of neurons, preserved brain glutathione levels, reduced brain edema, preserved the blood-brain barrier and squashed inflammation, which reduced brain cell death. There is a large body of evidence that melatonin can help prevent the initiation, progression and metastasis of cancer. Its ability to act as a free radical scavenger and how it stimulates endogenous antioxidant production means it prevents DNA single and double-strand breaks, protein cross-links and other defects. There is also some limited evidence that melatonin may support DNA repair as well. Melatonin's ability to lower oxidative stress and block other growth pathways may stop the progression of cancer. However, the evidence is mixed and its benefits might apply to certain types of cancers only. Melatonin has a modulating effect on the immune system. Some studies report that under immunosuppressive conditions it will act as a stimulant, while other studies show that it will act as an anti-inflammatory and an antioxidant when immune response gets out of control. Melatonin has protective effects in animal models when it comes to bacterial, viral and parasitic infection. It is able to reduce the severity of illness and increase chances of survival. In regards to autoimmune conditions, melatonin has both benefits and drawbacks depending on the disease. There is evidence that it could be helpful for type 1 diabetes, multiple sclerosis and colitis, while at the same time being detrimental in the treatment of rheumatoid arthritis and Crohn's disease. Melatonin has a broad regulatory and neuroprotective role in the brain. Research shows it is a promising therapeutic and protective agent in treating neurological conditions like stroke, Alzheimer's, Parkinson's and multiple sclerosis. A study published in the Journal of Perinatology investigated the neuroprotective effects of melatonin on newborns suffering from hypoxic ischemic encephalopathy. 30 newborns were given either hypothermia treatment or hypothermia combined with melatonin. The newborns which received melatonin had fewer seizures on follow-up tests, less white matter abnormalities on MRI scans, as well as improved survival without neurological or developmental abnormalities. An animal study published in the Journal for Pineal Research investigated the effects of melatonin on Alzheimer's disease. The researchers found that long-term melatonin administration preserved the neuronal and glial structures in the brain, as well as improved the structure of synapses and restored their functionality. Melatonin is able to stop abnormal protein aggregation in the brain, which leads to Parkinson's disease. In addition, Parkinson's has been linked with mitochondrial dysfunction and oxidative stress in the brain, both of which melatonin attenuates. Multiple sclerosis is a progressive neurodegenerative disorder triggered by an autoimmune response against the insulating layer around nerves. There is accumulating evidence that disrupted melatonin secretion may play a role in MS. A case study published in the Journal of Pineal Research followed a 28-year-old patient diagnosed with symptoms of primary progressive multiple sclerosis. The patient decided to stop steroid treatment and switch to an escalating daily dose of melatonin. The dose escalated initially from 50 mg to 300 mg and remained as the only treatment for 4 years. The patient experienced progressive improvement and MRI scans remained stable. The researchers believe the synergy between the anti-inflammatory and the antioxidant role of melatonin may induce neuroprotection and reverse damage caused by MS. Now let's talk about how to supplement melatonin safely and effectively. Most studies on melatonin show benefits from supplementing from as little as 0.125 to 10 mg, with average doses being 3 to 5 mg. If you're using melatonin to improve sleep, start with a dose between 0.5 to 3 mg daily taken 1 to 2 hours before bed. Adjust the dose up or down depending on sleep onset and quality. For the treatment of Gerd, most studies use doses from 3 to 6 mg, with the higher dose being more effective. For the treatment of acute trauma and neurodegenerative diseases, most studies use dosages in the range of 10 to 20 mg and above. And remember to always take melatonin on an empty stomach to get the benefits of improved insulin sensitivity and blood sugar control. If you have any questions, leave them in the comments below, and remember to like and subscribe for more content. Thank you for watching, and see you next time.